So today's topic of discussion is laser hair reduction. Today we will discuss about the different types of laser that is available for the laser hair reduction. First is introduction. The unwanted hair is the major cosmetic problem. So the traditional methods of hair removal that was available was shaving, bleaching, tweezing, cold and hot wax epilation, and chemical depilatories. The depilatories remove the hair from the superficial layer of the skin from the surface only, while the epilatories are the removal of hair from the deeper layers. Another method is electrolysis, that is permanent hair removal, but it is very tedious and operator dependent. It is actually a blind procedure, and recently there are number of lasers and lights that is developed specifically to target the hair follicles. So this leads to permanent hair reduction in multiple settings. The acronym of laser is light amplification by the stimulated emission of radiation. This acronym is coined by Gordon Gould. Max Planck is considered as father of laser technology. This is the photograph showing the electromagnetic spectrum in increasing order of their wavelength. The shorter wavelength are of cosmic rays, gamma rays, and X rays. Then comes the visible light, ultraviolet radiation, visible light, infrared. In higher wavelengths, we see in radar, television, and radio waves. Again, this visible light has been classified into UVA, B, and C. Ultraviolet C of wavelength 200 to 400 nanometer, ultraviolet B in the range between 400 to 700 nanometer, and more than 755 to 1064 nanometer is infrared waves. The anatomy and growth cycle of hair follicle we have learned in previous classes. The on longitudinal section, hair has been classified into four types: infundibulum, isthmus, and inferior segment is classified into bulge and hair bulb region. So bulb consists of germinative matrix cells and melanocytes. The bulge is the area of hair follicle at the site of attachment of this muscle, that is erector pili muscle. Melanin is present in the hair shaft, matrix area, and outer root sheath of infundibulum. So infundibulum is the topmost layer. You can see from it is a funnel shaped structure from the surface of skin to the joining of the sebaceous duct. Uppermost you can see infundibulum. It is also known as acroinfundibulum. It is superficial infra-infundibular portion. And sebaceous duct, that portion is called attachment of sebaceous duct is isthmus, and below this is inferior segment, which is again classified into two parts: area of bulge and lowermost is bulb area. So this hair cycle is again of three types: anagen phase, catagen, and telogen. Anagen is the phase of active hair growth and it lasts for about 6 years. Around 84 to 90% of our hairs are in the anagen phase. Next is catagen. Around 2% of hairs are in the catagen phase and the duration is of 3 weeks. And telogen hairs, around 10 to 15% of hairs in the telogen phase, and the duration of telogen hairs is 3 months. So in the anagen phase, the hair proliferate and move upwards. It gives rise to hair shaft and inner root sheath. It is 2 to 7 millimeter below the skin surface. In catagen phase, the lower portion gets apoptosis and it shrink and retract upward. In telogen, that is stage of follicular quiescence. So these are the three phases of hair cycle. Also, there are 6 types of Fitzpatrick skin type: 1, 2, 3, 4, 5, and 6. In skin type 1, the color of skin will be pale white, blue-green eyes. The color of hair will be blonde or red hair. it always burns and it does not tan. So type 1 skin color will always burn. Type 2 is fair skin with blue eyes. It burns easily and tans poorly. Type 3 is darker white skin, that is tans after the initial burn. Type 4 and 5, the mostly the Indian skin is of type 4 type. It is light brown skin. It burns minimally and tans easily. So easily tanning is common. In type 5, it is brown skin. It rarely burns, tans darkly and easily. And type 6 is dark brown or black skin. It never burns and always tans. So these are the 6 types of Fitzpatrick skin classification. We should know before setting the parameters of laser what is the color of hair, what is the color of skin, thickness of hair. These parameters we have to assess visibly. Now, different types of lasers that is available for hair removal are ruby laser of 694 nanometer wavelength, Alexandrite laser 755 nanometer, this nanometer wavelength, diode laser between 800 to 810 nanometer. It is the gold standard for the hair removal. That is most commonly used laser is diode laser of the wavelength 800 nanometer. Next is long pulsed ND-YAG laser. ND-YAG is neodymium, yttrium, aluminum, garnet. ND-YAG laser. The wavelength is 1064 nanometer. We have to remember the wavelengths of each lasers, like we should by heart it. ND-YAG is 1064, diode 810 or 800. Alexandrite is 755 nanometer and ruby laser 694 nanometer. Uh, Other methods are IPL, that is intense pulse light, in between the wavelength of 550 to 1200 nanometer, and light and heat energy, that is 400 to 1200 nanometer range. So these are the different lasers that is used for the hair reduction. The procedure for laser hair reduction, this is the methodology, how we have to proceed. First, we have to take the detailed history and thorough clinical examination. History in the form of the age, other hormonal imbalance like thyroid, sugar, prolactin, menstrual irregularities. We have to clinically examine the hair growth by Ferryman-Galvez scoring, hormonal assay. Also, in case of polycystic ovarian syndrome, we should perform this abdominopelvic ultrasonography. And before proceeding for the lasers, we should obtain informed written consent, hair count and photographs before treatment, and then once in every 3 months. We have to set the starting fluence and pulse duration and determine according to the skin types. We have to see the skin type in between 1 to 6. And in every sitting on each treatment visit, we have to increase the fluence by 10%. The laser treatment sessions, they are performed at 4-week interval, that is once in a month session. And later on, we can proceed for the 1.5 month interval also, and 6 laser sessions to be performed, and it is followed by touch-up sessions. So maximum we can proceed for the up to 10 sessions also. So average is 6 to 8 sitting. Then we have to give the touch-up sessions. So this is the protocol.